But first, mindset shift number 1, rethink retiring before 65.
And this is part of that fun conversation that we get to have with the people that we work with our clients, with our families, is showing them, illustrating what they don't know. So people expecting to retire at age 65, so they have this seamless transition from employer plan to new health insurance being Medicare. Well, let's broaden that spectrum. What does rethinking that look like? So now we introduce this gap. Let's retire a bit earlier than 65. Well, how are we going to build this bridge to avoid drowning in this water? Our first option we're going to talk about is COBRA. COBRA is a federally mandated program that requires employers to provide a continuation of the employer coverage for a minimum of 18 months. And this coverage is available to you whether it was involuntary or voluntary separation of service. It is also available to any dependents, spouses, partners that were also covered on the employer plan. Now, COBRA can have some stigma with it as being so expensive because basically what happens is you take over 100% of the cost of the monthly premium. So now we have Jill. We've introduced this idea to COBRA to her where she could have this bridge of coverage for 18 months, which would mean that now Jill is considering retiring at age 63 and a half, reclaiming those 18 months. So now it all comes down to numbers, right? So we look at her overall plan, and this is the information that we know. That while she is working, she is currently paying $100 a month to be on her employer plan. And then she finds out COBRA costs. So she brings that information in, and to be on COBRA, it will cost her $400 a month, which basically means that her employer was providing $300 to offset that premium while she was working. Now, what is Jill's other option? We all love to have options out there. Her other option is the marketplace, which is also known as the Affordable Care Act, also known as Obamacare, and these are qualified federally regulated health insurance coverage options available to you on healthcare.gov. And what can determine those monthly premiums is income. So we look at her income planning and we see if there are any savings that we can take advantage of on the marketplace. And we were able to implement within her income plan to where she would have a savings on the marketplace to where her monthly premium would be $450. So knowing these numbers, we were able to put together the cost if she were to retire 18 months earlier than she originally expected. The total would be $5,400 in monthly premium so that she can reclaim those retirement years. So all Jill needs to find out now is $5,400 worth it to her to retire earlier?
AnnaMarie, there are a whole bunch of Jills jumping off the couch right now, just cheering because you put some numbers behind this decision, which is so powerful and necessary for everybody to do. If you want to retire at 65, you're 63 years old, put some numbers around that decision. And what we just learned from Jill is $5,400 would be that cost to reclaim an extra 18 months of her go-go years, 18 months extra with the grandkids and traveling and doing those types of things that she's always dreamt about. But wait, what if you're not Jill and instead of $5,400, it's $5,000 or it's $50,000? That's a number that you can use to help identify what is most important to you in this decision. And many people we talk about, if that number is even $50,000 and they can look at age 90 and say that I'm going to have $50,000 less or $60,000 less than if I would have worked till 65, they're looking at us and saying, I'm gone. I'm going to reclaim those 18 months, those 2 years of the go-go years, because at age 90, it's not going to be that important to me.